Hello, I'm John Eberly, and I am a family physician at Eastside Medical Group. I chose to become a physician probably in a great deal because my father was a physician, and that was my exposure early on. But the more I took my science courses and I did some rotating through the hospital as a high school student, kind of being a nurse's assistant, and I really enjoyed the exposure and the ability to help the nurses out in some of the more mundane tasks, but that really piqued my interest in terms of medicine. As a family physician, of course, you can do all aspects of internal medicine. So some family physicians do more pediatrics and others do more orthopedics. I really enjoy middle-age hypertension and lipids, which has to do with cholesterol and heart attack risk reduction and diabetes. Those are the areas I tend to focus on, and I really enjoy those. I do enjoy hearing about things that are going on in the family. And for the most part, though, it's kind of the bread and butter family medicine. We do a little bit of everything. The most rewarding thing about being a family physician is the ability to interact with different patients every day. Even though I go to work every day like every other physician, the thing I enjoy the most is the variety. So I may see somebody with depression, turn around and see a child with a rash, turn around and see somebody who's just got through with open heart surgery, and then see somebody with diabetes. So that constant variety is a big challenge to me, and I really enjoy that part of my life. The approach that we give to caring for our patients, first and foremost, begins with how they're handled on the phone. I have always said, and I really truly believe this, we have some fantastic physicians in the Bon Secours network. We really do. And I would like to think that my staff is why my patients come back to my office, not because of me being some outstanding physician. So I think the way we care for our patients from the moment they're on the phone to the moment they come into the office, and once they're in the examining room, really by this point in your life, you should be able to pretty much figure out what their medical condition is. So how do you treat them? Do you treat them like they're your mother or your father or your next door neighbor? And just that interaction, the ability to get to know the patient and hear about what's going on in their life. That's kind of our culture, and that's what we like to do at Eastside Medical Group.